Hey everyone, this is Dr. Muhammad Atalla. I'm here with you guys. I just want to say I'm very honored to be with you in this event, and it's a very good opportunity for all of you guys and me before you. So I'm just happy to be with all of you guys, and I wish that I can help you with anything you need. So I'll just start with a small introduction about myself, and then we can go straight forward to the cases I'm willing to discuss with you guys. So yeah, that's pretty much it.
You're muted.
Sorry, are you able to switch to the following slide? You can.
Yeah, it's just taking some time.
Okay.
So, I'm Dr. Muhammad. I'm from Egypt, Alexandria to be specific. And I'll just be starting with you guys about the system in Egypt and how everything started with me, you guys here. And I hope I help you. So I started in my education in the Miss University for Science and Technology. I'm now a dental resident at the oral surgery department at Saad Kafafi Hospital of the university. Here, here in Egypt, the system is different from the US. I hope that you can just understand it a little bit with me because it's a little bit different, very, very big difference. In Egypt, the system is divided about only 3 years, and you have 3 years of high school. The last year determines which university are you going to be with. Because in Egypt here, your marks and your grades determine which field are you going to study. Like if you want to be a doctor, you can't be a doctor unless you get high marks in the last year of high school. So yeah, it's a little bit unfair, but you can just you cannot say no to this. So I have some deciding factors that made me go to dental school. Like the main one is that the dental organs are the only organs that you cannot fix by medication, that they need your intervention and your contact with the patient. And they pretty much need help. Like if a patient has a problem with his teeth, he will not sleep. That's the point. You can see the progress immediately. You don't have to wait for some medications to work and stuff like this. I received a scholarship in restorative dentistry, a master's scholarship from Michigan University. So I'm just waiting till I finish my residency so I can reapply for this scholarship. And in Egypt, the residency programs are different from the United States in some things where sorry, 1 second. Yeah. In Egypt, the residency programs are not just like the US. Like in US, if you want to have a residency program, you just specialize in one program. Either it's oral surgery, restorative dentistry, endodontics, and stuff like this. But in Egypt, it's in the form of rounds where you have 12 months that you just go in rounds according 2 months in each specialty until you decide which one you want and which one you like the most to specialize in after that. In my case, I like the oral surgery and the oral maxillofacial surgery. That's the field that I'm willing to specialize in, and I hope I can do that. So, as I said, I'm a dental resident. I'm planning to specialize in the maxillofacial surgery. The best thing about the system in Egypt is that, as I said, you can take information about everything you need in every field before you specialize, and this will help you to get more in deep with the specialty you want. And it's just like in the US, if you enter the specialty that in the middle of the way you didn't like or something like this, you cannot get back from, but in Egypt you can. So that's the major plus in this system. Other than this, I don't find a lot of good things in the system. So I started practicing dentistry as an operator in under the supervision of one of my professors. He's called Dr. Akram in Alexandria, here in Akram Khafagi Dental Center. He is specialized in surgery too, and he's like a mentor of mine. And he really helps me a lot. And he's like one of the main reasons that I'm in the field of surgery. So the main points about deciding why do you get the job or not. So first thing you need to be looking about or for is your team and your working environment. And the biggest one for me is the salary, because like we are doctors, so we need good salary. And the best thing about being a dental resident that have a salary is that you can start your own salary like limits. So if you are a dental resident and you accept a low salary, you will you will stay with a low salary for the rest of your life, at least here in Egypt. But if you start with like intermediate or large salary, you will stay like this forever also. So I'll talk about Egypt a little bit because I don't really have the full information about the US system. But in case of the clinics and the businesses, whether it's private or corporate, the benefits and the cons of these things, like in my like opinion, whether it's in Egypt or in the US or any place in the world, when starting a business, you don't have to be the owner of the business. You can also work under someone's supervision, because you will need like a lot of experience and a lot of stuff to know before you can hold um, a private business. You will face a lot of problems. You will have to deal with patients. More than this, like it's our job to deal with patients, but more than this, you will have to deal with a team. You will have to lead a team. And in my case, when I graduated or like when I started working with people, I didn't have this experience. I didn't have the ability to work with to lead teams. It was just I wanted to be led, and I wanted to be like I wanted to follow someone who's like having more experience than me, so he can help me and I can get some information, I get some experience from and stuff like this. You have a lot of to learn when you graduate. You will have a lot of things to learn, so you cannot actually launch your own business the moment you graduate. And that's my opinion. Some people succeeded in launching their own business and they're actually very successful now, but I see that this is a risk, and to be honest, I'm not willing to take it, and I don't think any of you is willing to take it, because in dentistry we'll lose a lot of money if this didn't work. So let's go to the next slide. I volunteered in India in the past 2 years. I volunteered for like 2 months in India, in Delhi, and I worked under the supervision of Dr. Esther from Budapest and Dr. Ahmad Muharram from Egypt. He's one of the people that I'm still working with until now. I've volunteered under the supervision of Dr. Rajat Agaria from India. He's a very nice guy, by the way. Indian people are like Indian dentists are very, very like educated. India, like, we have those news about India that they're like third world country and stuff like this, but they're actually in medicine and dentistry. They are very well educated, and they have new techniques and stuff like this. Like the lack of new things and technology just give them the space to perform new techniques and stuff like this, that makes it a little bit easier and can get you away without having the technology. Also, I got to know Dr. Molly Kirby from from England, and she is a good doctor too. But English doctors are just different from any other people, because first thing, you cannot understand anything from them. They're always uh, I don't know how to explain this, but they like to show a lot. I don't like that. I don't get that from anyone I've volunteered with. But all of them are good professors, and they help me through the way, and they have a good impact on where I am and where I'm going to be. I still have contact with them, and they actually help me. The best thing about dentistry also is that you can get everything you need through the phone. Like if you have a case that's very hard and you don't know how to act or deal with it, you can just call a professor or someone who's higher than you and ask him for like information or how to do, like they will put you where you need to search. And this is the best thing about dentistry. And I see that's a plus in dentistry other than medicine, because medicine, you need to study a lot of things and you need to work a lot. And at the end, you will be like as same as anyone else. But dentistry, you can work with your hands. If you have the good skill and you just like work on it, you will just reach there to some place that's very good in your life and in your career. So Before we start discussing the cases, I want all of you to know, like, can anyone like know anything in this diagram? Okay, I'll discuss with you guys. This is the trigeminal nerve. It's one of the main nerves like, this is the main nerve that you're going to deal with in dentistry. Like, this is the most critical and the most important nerve you will deal with in dentistry. The trigeminal ganglia is like in the form of three main nerves that are coming from the space where the ear is, this part, and is divided into three divisions. The most important one in dentistry is the last division, the inferior alveolar nerve, okay, or the mandibular nerve that will be divided into two nerves. So the first nerve of these three divisions is the ophthalmic nerve. It supplies the eyelids and the lacrimal glands. The second division is the infraorbital nerve, and it actually at the end it supplies the it supplies the all of the anterior and posterior upper teeth, so the incisors, canines, premolars, and molars. And the last division, which is the most important one, because it's subdivided in two other divisions, which is the mandibular nerve. The mandibular nerve is divided into the infraorbital nerve, which is this one, the one supplying all the teeth, and the lingual nerve that supplies the tongue and the lingual mucosa. The most important thing is that you need to know that the inferior alveolar nerve is one of the critical nerves, as it's inside the bone. You cannot really see it like the lingual nerve. Like, if you made a flap in the lingual mucosa, you can see the lingual nerve, but you cannot see the inferior alveolar. So if you want to extract or do any surgical procedure, like um, for any of these lower teeth, whether it's the anteriors or the posteriors, you need to actually aim the place where you put the anesthesia, because this is the major problem with all dental students. It took a lot of time for me to learn how to anesthetize the lower teeth. It's very hard. I'm not saying it's doable, of course, but like, it's very hard to aim at the inferior alveolar nerve to get it like the exact correct position of the of the needle insertion point, but it's doable. The best thing is that now the anesthesia, the new technologies in anesthesia, is just like the infiltration technique. So you don't have to be precise with the point of injection. So you can just like half centimeters in or out, before, after, then you will just get the nerve fully anesthetized. But for the for the anesthesia to be profound, you need to aim it in this inferior alveolar nerve. Why is it critical and why is it important? Because it can easily be injured, and it controls the sensation and everything, like for the lips and the tongue. So if you made an injury to the lower inferior alveolar nerve, you can easily lose sensation in the lower lip forever. And that's the most critical point about it. And you actually, like, I know this is like an introduction, it's a boring one, because actually I don't like this one, since like I was in year 2 or something. And just like, this is an introduction that's necessary for you to understand the following cases. So this is the first condition we will be having. This is one of the most important conditions in surgery. You can see them like a lot with high rates in the dental office, and it's called perichromites. From the word, you can understand that this is an inflammation, and peri means outer or upper. So it's the inflammation of the coronal. So coronitis, this means the coronal part, which is the upper part of the tooth. So it's an inflammation of the tissue covering the upper part of the tooth. So as you can see here, this is the word operculum. Operculum means that this is the soft tissue covering the lower molar. Yeah, it's pericoronitis is the condition of it's only for the lower teeth, and especially for the lower third molars, because the problem is that the upper teeth just bites on the lower soft tissue, as you can see in the second picture, and this will cause the inflammation, leading to the swelling. This will lead for the enlargement of the tissue, causing more biting on it, so it will be inflamed. This condition is just like why is it so serious? Some of you, I'm sure that some of you got this condition and it's just passed away easily. But the most serious condition about this is that you can easily lose the ability to open your mouth, because if this inflammation got more infection, you can just like lose the sensation to your like cheek muscles and the muscles that can open the oral cavity or the mouth opening. So you can get limited mouth opening, and you can just lose the ability to open your mouth for like at least 1 month. And none of us can live with this, of course. Like, that's too hard, and it's actually painful. So to sum it all up, is the inflammation of the operculum over the third molar, especially the third molar. You can find it if, like, some people are born without third molars, so you can find it on the second lower molars. But most of the time, yeah, 90% of the cases is the third molar. And it's actually due to, sometimes it's not just due to the biting, it's actually due to the partial eruption of the third molar. So it's like there's no space for it to erupt, so only a small part of it erupts, pushing the mucosa and the soft tissue upwards, allowing the biting of the upper third molar or the upper teeth on this soft tissue. And plus the accumulation of food beneath it and on it, this helps in the infection and the bacteria accumulation, dental plaque stuff. All of this stuff helps in the inflammation process, leading to more pain and more swelling. And the treatment is actually very easy, but it depends according to the condition of this inflammation. As all of you guys know, that there's inflammation that is either one of two conditions. It's either acute or just chronic. So in the case of perichromitis, you cannot treat it in an acute phase. You have to wait until it's chronic, or the acute phase just resolves itself. So in the cases, like, the treatment is either one of two ways. It's either the extraction of the tooth causing the inflammation, which is the lower third molar, or it's actually just something called operculectomy, which is just cutting the piece of the tissue that's getting inflamed. But in my opinion, I prefer just taking the tooth out, because it will just like, some of the people and some of the patients, their bodies develop the same tissue again, but it gets larger this time. So it's like your body trying to avoid this process of cutting it, so it's getting it more thicker and more bigger soft tissue that's going to lead to some serious infection after that. So I prefer just taking out the tooth and making two sutures, and that's it. But to treat the acute condition, so you can be able to do any of these two surgeries, you need to actually just use 3% concentration of hydrogen peroxide, and that's the only treatment. You can rinse with that. If you don't have that, you can always tell the patient to rinse with warm water and some salt. That's the best treatment for the perichromitis in the acute phase. After the acute phase resolves and it gets chronic or to normal tissue, you can always just cut the operculum out or just extract the tooth. Some people, like orthodontists, they don't like the process of tooth extraction, uh, because, like, if you have a problem in the second or the first molar, you can just do an orthodontic treatment to move the third molar in their position, so you can get used from this molar. But in my opinion, um, I don't like orthodontics. So I don't feel that I should like follow these rules. It's right, it's not wrong. It's actually like you can benefit from a tooth, but when you study dentistry and dental morphology, you will find that the third molar is not always like this, the normal molars, and you cannot always get used from it because it's a flat surface without grooves, so you cannot bite on it really good. And just a piece of information for you guys, the third molars were actually used by the ancient human being when they used to eat meat without cooking it. So they needed large number of teeth with large forces, and the most forces you can get are the molars. So you need large number of molars. Like in the oral cavity, you will have like 8 incisors but 12 molars. So that's what I'm trying to say. So but now we don't need that. So, and actually some people from the new mutation and new generations of human being, and I'm sorry for the term of new generations, but it's actually the truth, they get born without any of the wisdoms. They just get 28 teeth or 30 teeth, none of them. I got the four wisdoms, I got them all out for myself, and it was easy. I don't actually use them. I've been working with some orthodontists, sorry, in the second and third year of my dental school, and yeah, they can use it. They use it a lot. Actually, like some of people like have some condition called crowding, where their teeth just like get inside each other because there's no space. Their jaws doesn't grow, and the molars are just too big. So orthodontists like they actually, some of them actually hate the third molars because they ask the patient to take them out to leave some space for tooth movements. But yeah, this is like the first thing that you sacrifice because you don't actually need them and you don't use them. Some people have them impacted until the day they die, they don't use them. And in my case, I just see that if you don't use it, then you don't have to have it, because you just like need to avoid the problems that can cause it. So I'm a little bit aggressive in treatment. Some people say yes, I'm aggressive. Like I just I prefer to avoid problems instead of like having them and dealing with them after that. Like if there's a problem that you can stop like from happening before it happens, then yeah, why not? So that's my advice for you guys. One of my advices for you, that you need to start looking for the problems and then deal with them before they happen. But yeah, don't be aggressive. So the perichromitis was the partial eruption, so it's partially impacted too. But in this, also this new case, it's one of my cases. It's a friend of mine, actually he's a dental student too in my university, and I just worked with him. He had an impacted tooth. So the third molars are also the main teeth that can be impacted, and there are many types of impaction. The first type is the most common type is the mesioangular, which is the first picture you have on the left. It's just like the tooth is shifted medially toward the teeth with only a small part of it erupting in the oral cavity, only one of the cusps. And this is the easiest impaction that you can deal with. You don't actually need like major surgery. You can only like extract it with the forceps. It's called achromatic extraction. And the second type of surgery is, sorry, the second type of impaction was, which is horizontal impaction, where the tooth is like completely sleeping. We call it the sleeping wisdom. It's the completely sleeping tooth inside the mandible, inside the bone. So you have to take part of the mandible out and then take the tooth out and then fill this with like a bone graft, or if you don't have to, if it's close to the surface, then you don't have to do bone grafts. The other type of impaction, which also one of the easiest type, is the vertical impaction, where the tooth is just like upright position in the position where you need it, but it didn't cut out through the bone and the mucosa, so you will have to open a space for it. Some dentists just open an opening in the mandible for it to erupt. In my aggressive personality, I just like to take it all out. The one of the other types of impaction is the distal impaction, where the tooth is like shifted distally, so part of it is in the ramus of the mandible, which is the upper part of the mandible. This is actually a hard type of impaction because you can risk fracturing the whole mandible, and a fraction of the mandible is just like untreatable without major surgery. You will need like pins, you will need flaps, you will need everything that you can learn in surgery, big sutures which will leave like large scars. So in cases of distal impaction, you need to be very careful, very delicate with the mandible and the tooth. The problems with impaction is that you can actually, or actually you can easily leave a part of the tooth inside that will cause infection, and that will cause problems. Like after that, it can cause swelling. It can cause a condition called cellulitis, which is the swelling that spreads all over the face. So you can just like do a surgical extraction for a patient of the lower third molars today, and after 2 days, he will get to you with the face swelling like he had an accident, and he's actually not feeling anything. He's just feeling numb. And if you did an X-ray or something like this, you will find that you left one of the roots inside and it got infected, and it just like the numbness And as I told you before, the inferior alveolar nerve is near to all the molars. So the infection in any of the molars will lead to the numbness of the inferior alveolar nerve, causing the pain sensation of the tooth, but the numbness of the rest of the face or the rest of the side. The best thing about the dental pain is that it doesn't cross to the other side. It can be referred pain, but on the same side. So if a patient came to you telling you that his wisdom of the right side it hurts, it doesn't mean that it's the wisdom of the left side referring to the right, but it can be the upper wisdom referring to the lower one, because they're actually very close, because they are at the part of the angle of the mouth. So the best thing of dental pain that you only have to look in one side. If the patient is complaining about a specific side, you don't have to look to the other side. And that's one big plus in dentistry that you don't have to deal with in medicine, because in medicine the patient come to you saying ouch, and then you have to start all over searching all over his body for some problems. And it can be like the patient can actually having problems in the dental field, but it originates from the medical field. Like he can have some problems in his stomach, in his esophagus, and it's actually causing pain in the jaws and teeth. And you will just like see these conditions when you get into dental school. And the most common one, the most like popular one, is that the myocardial infarction. It's a heart condition that causes the pain in the lower teeth, especially the left side of the jaw. It causes severe pain. The patient comes complaining from the lower left teeth, but he actually is going through a heart attack. So that's the problem with dentistry and medical field. I prefer the dentistry than the medical field because it's specific. You can easily find the solutions and you can easily see the progression of the treatment that you started with. And you can see the results, like immediately see the results. And one of the most important things in dentistry, other than medicine, is that you can see that the satisfaction and happiness of the patient at the same visit. Like if you did something good for the patient, he will be very happy about it, and you will just see the happiness. And this is one of the best thing about dentistry. And I see that this is one of the essence and the main rules of dentistry is that we are dentists, we are doctors, and we help patients. So we need to see them happy so we can follow with our lives and we can be happy too. And in dentistry, if you saw that you made a good job, you will be happy about it. And I'm sure all of you guys will do the same thing that I did when I was like younger. I used to take pictures of the cases before and after. And it's actually a good thing for you guys to start like businesses and stuff like this. It's like a good advertisement, good promotion for yourself. And it's actually it's a good encouragement for yourself. Like if you see that you worked with a case and you did good job, you will just be wanting to work with others. And that's the case with me in surgery. Like I started working in cases. First I was shaking, I was afraid, and then after the first case I like the I like the process, and I started working with it. And now it's not about extracting the tooth as a whole without breaking it. It's actually like getting a bit challenging. So I started working on the timings, because one of the things that you will learn in dentistry that you need to work with is time. Some patients suffer from opening their mouth for long times. Some patients are children that cannot open their mouth for long times. So you will need work with time, and that's what I'm doing on myself. That I'm working on myself in this process, that I need to work good jobs in low time. Like an average molar extraction, like an average impacted molar extraction takes 15 minutes. I do it in 9. So, and I'm willing to just like get in like in smaller time. So yeah, you will need to like focus with time, and you will need to learn you will learn that dentistry is better than anything actually in the medical field, whether it's like medicine, pharma or anything of this. Like yeah, it's better than anything. So this is my friend. His name is Ahmed. He's a 22 years old. He has the complete set of teeth. The 32 teeth are present. You can count them. He needed orthodontic treatment because he had crowding in the anterior teeth. As you can see, there's a lot of overlapping, mesial and distal overlapping. He had his teeth like in front and the back, in the front and the back, so it's a little bit of crowding. He has this problem in the upper teeth too. But I was the one, I was the doctor of this patient. Like I had to deal with this molars, these two wisdom molars, because actually the crowding in the lower teeth was very deep and was very hard to deal with. Some of the teeth are, as you can see, are just twisted, like this tooth is not just in the right position. So to start the orthodontic treatment, he needed the space for movement of the teeth. As you can see here, this molar is mesioangular impaction, and this also is a mesioangular impaction, and this is because there's some like cusps of the lower wisdoms protruding in the oral cavity. You can see them actually clinically, you can see them, and I'll show you the case after this. The pain, yeah, after that it started, like he was okay with it, and then he started developing a lot of pain, and this is because some of the food debris and some of, like, when his immunity got down, he got COVID and stuff like this. His immunity got down, so the bacteria and the food accumulated under the soft tissue between covering the tooth and in the oral cavity, caused it to inflame and caused the infection. And this led to the pain that it started like as a mild pain that he can feel, like, but it's not like worrying him. If he takes some aspirin or some ibuprofen, he works with it very fine. But after 2 or 3 days, the infection became severe and the condition turned to acute, so we couldn't deal with it until we just resolved the acute condition, which, as I said, we had to give him some hydrogen peroxide, and it's only for 3 days, and then the condition got resolved by itself. So we had to do the surgery ASAP. The problem was that, as you can see, this red line is the inferior alveolar nerve, and actually the roots of this molar, the roots of this wisdom, were twisted around it. So in that case, if we forcefully extract it, we can actually cut the inferior alveolar nerve, causing him complete paralysis for the rest of his life in his lower lip and in his lower teeth. So if he had a cavity or had caries or had pulp pain or any condition in his teeth, he wouldn't know it until it's like too late to save it. And he will also not feel his lips for the rest of his life. So it was a little bit tricky. And we dealt with it in like an aggressive way, actually, because I was the doctor treating this patient. Some doctors, like one of our doctors, were like, okay, deal with it in slow way, don't be forced, don't put some force, don't do all of this stuff. But one of the things you will learn in dentistry, that there is a million way to do the main thing. You can just do more than one approach, you can lead to the same specific result. Actually, sometimes you can be superior to your professors, you can like be better than them, especially in surgery, because like there's no mistakes here. Because what's the main mistake you can do in a surgery? You already like have someone open on the table, so you cannot make any mistakes. There's no mistakes to be done. So you can just, like, I started working with it. I starting the technique called the guttering technique, which is using the handpiece with a surgical burr to move some bone surrounding the tooth, just to get it a little bit of looseness. You can hold it and you can just manipulate the tooth and stuff like this. The most common treatment for this condition is just like um, cutting the tooth, sectioning it, or splitting it into two halves, taking each half out. But one of the things that I find challenging for a dentist, or actually a surgeon, is to take out the tooth as a whole part, as a whole unit. Some people like sectioning. They say it's a clean extraction. It's an easy one. It don't take time. But I actually don't see that this way of extraction can show your skill or your abilities in this field. So I like to take the tooth as a whole unit out. And this is what I did. I just used the handpiece to just like remove the bone around the tooth, get it some looseness where you can hold it and get it out of its socket. And in this, like, this is the dangerous part about this technique. Actually, this technique was made in the US. It was like invented in the US, especially in Michigan Dental University. and it was a doctor. He was actually he was of Japanese origins. And one of the things you will learn about Japanese techniques is that they are very aggressive, more aggressive than I am. They actually they managed to develop some tools and dental extraction tools that can easily cause fracture if you don't take care. Like there is a one of the tools is called a T-bar, and this T-bar puts, like, you can put with your hand a force of 1 megapascal. This will lead, like, this will multiply the force by 10, so you can easily fracture the mandible. And like the patient is coming to extract a wisdom, he will leave out with a fractured mandible. So yeah, this technique, what I like about this technique is, yeah, you can injure the inferior alveolar nerve very easily. I don't actually recommend using that technique, but it's, if you just like want to challenge yourself and want to challenge your professors and want to like improve your skills, then yeah, use, like, don't be afraid, don't be worrying about anything. Like the best thing about being a student is that there's a superior above you that will help you, that will save anything that you do. I don't mean by this like to make everything wrong, but just like don't be afraid. From like one of the things I learned in dentistry, that if you got afraid, you will just like do some problems and you will just like make mistakes. So as you can see, this is the part of the tooth. Like here's the part of the bone that I took out around the tooth. This is called the guttering technique. You just like use a round surgical burr to move, to remove the bone around the tooth where you can find its looseness. And then you will just like use something called the periosteal elevator to just remove the bone, and like remove the fragmented bone and remove the soft tissue from the area you are working in. And then you will use something called an elevator, which is the black part here, this one. This is called an elevator. You will actually, this will be your friend if you decided to work in the specialty of surgery. You will actually have it in your pocket because this is, you will use this in everything in dentistry. Like each tooth has a certain type of elevator, but when you get some skills and some of this stuff, you will just learn that you can work with everything in every position, just if you know how this tool works and how you need to use it. So the best thing about the one of the best things about the surgical field is, yeah, there's nothing called you have to do this way. Like there's no specific way to do stuff. You can do everything in many ways and get the same results. Actually, some of them are better than how the books say you can deal with it. So as I said, you just like, I used the guttering technique. I used the round surgical burr to remove bone around the tooth where it get me some looseness. And as you can see this, the curve, this curve, you can see this where you can engage a forceps or you can engage an elevator. And we also said it's just a click. As like the moment you insert an elevator at this point and just put a little bit amount of force, it will just click out. It will, the third molar will just jump from its position in the oral cavity, and you can just take it easily out. The most challenging part in cases like this is not taking out the tooth or just like preventing an injury to the inferior alveolar nerve. It's actually the most tricky part is after you do all of this. And the tricky part here is with suturing, and some of these cases have inflammation and infections. So you need to clean the area or the space you have worked in after you take the tooth out. Because if you just sutured and close the field with some infection inside, you can put the patient in some great risks that he will not know anything about until it's too late. You can actually, like, if there's a small fragment or a small piece of food debris or a small piece of any foreign body that entered this space, and you just sutured over it and close the wound over this, or the space, you just like close it, prevent air and everything like that, you will allow the bacterial growth inside without knowing that this happens. You will only know when there's like gingival hyperplasia or the tissue just got swollen, causing pain. And the problem is that it will cause pain and swelling without knowing what's the problem, because after 2 or 3 days, the sutures will be okay. You can take them off and the tissue will get back to normal. But after the progression of the bacteria and the infection underlying the soft tissue and the mucosa, it will just cause swelling, and you will not be able to locate where the problem is. So that will put the patient in risk. The problem is that even if you understand where's the problem and you could locate the problem, where is it, it will be too late to save the process. Like some people, I've worked in cases of impaction that we had to take out a part of the mandible out and then do a bone graft from the ribs or the pelvic bones, because the patient was like, he wasn't caring about the process. He just had pain. He didn't want to deal with it anymore, so he went to the dentist. He took it out. The dentist was careless with treating the wound after extraction. It led to an infection that caused after that osteomyelitis, which the inflammation of the bone. This osteomyelitis progressed, causing a tumor, and we had to take it all out. Like half of the mandible was taken out, and that's a great loss for someone. He will not live like this any longer. Like he will not live normally any longer. He cannot put some forces as you used to be in chewing the food. Your mastication will be weak. The forces you apply on the food will be smaller, so you will have problems with your stomach, your problems with your gastrointestinal tract, as you're swallowing unchewed food. So this will cause a lot of problems, and it was just because the dentist was careless enough to clean the wound after the extraction. One thing you need to know, actually, I forgot to tell you this, that dentistry like deals a big deal with the gastric area or the gastric organ, because if you don't chew the food good because of pain, because of caries, like the patient cannot chew the food very good, this will cause some problems with the gastric process. It will, like, some patients goes to the doctors complaining of stomach pain and like problems with their like gastric movements and stuff like this, and it's actually because they don't chew the food very good. And if you ask them, do you have any dental pain, if do you suffer from anything, he will just say yes, this, like the right side, I cannot chew on it because there's like this cavity or that pocket. It's just like tooth is a start of a lot of problems that can go through the body. So yeah, that's one of the best things I know I like about the dental field, is that you can save a lot of stuff and you can prevent a lot of problems just by saving a tooth or two. So as let's get back to this slide here. Okay, one second. Yeah, here this molar was the tricky one because it was near the inferior alveolar nerve. But if you saw like the upper teeth, the upper molars, or actually the upper wisdoms, there's nothing called an inferior alveolar nerve in the upper jaw, but there's one critical also like one critical process or one critical part of the jaw, which is this line, this fine line. This fine line is the line between the oral cavity and the sinus. If you can see, this is the maxillary sinus, and this sinus is very, very, very critical place that you can deal with, because any infection in any tooth can lead to an infection in the sinus, causing facial pain, and it will cause swelling in the nose area, in the eye area. And if you read a little bit in anatomy, you will find that there is an area in the face called the dangerous triangle, which is this area, and it's the area of the sinus. And why it's dangerous? Because it can spread the infection to a lot of places that you cannot know of, as I said, until it's too late. Like any tooth infection, some people can catch a cold or influenza, or lately the coronavirus. The people infected with corona have been developing this condition that they suffer from dental pain, like the upper teeth are hurting them, but actually there's nothing wrong with the upper teeth. It's actually the sinus are infected, causing the infection of the teeth, causing their pain. But actually, because the innervation in the upper teeth is more than it's in the sinus, so it causes like more pulses and more pain in the teeth rather than in the sinus. That's the first thing. The sinus, like the sinus line, is actually a fine line of 0.5 millimeter. And if you actually made a hole in this membrane or in this area, you will just open both of the cavities, like the oral cavity and the nasal cavity. You will open both of them, allowing some passages of bacteria, food debris, and stuff like this. You will find many cases in the surgical field under the name of oroantral fistula, which is opening between the oral cavity and the nasal cavity. The patients will suffer from, just like if a patient drinks some water, the water will come out of his nose. This means that infection can go from the mouth to the nose, and bacteria, like the most place in the body that has bacteria is the oral cavity. So you can just like move bacteria from the mouth to the nose, and this will put the patient in danger of a lot of things. Actually, one of the mistakes I did when I was in the second year is that I did the communication, this oroantral communication. I was working with an upper second molar. I extracted it with a little bit of force, and it led to an injury to the sinus. I had the communication, but thank God I was able to save it. And like none of my professors took took some of my marks out. But that's the dangerous about this stuff, is that the danger is in, like, you can just put something in the position where it shouldn't be, and this will cause problems, a lot of problems later that you cannot be knowing of, because the facial area is full of nerves and full of like vessels that supply blood in areas that you don't know until now, which will lead that you don't feel the pain or you don't feel the infection right away, like as any other parts in the body. You will just feel it after a lot of time, and this will be, as I said, too late to be saved. You will need just to go have surgical interventions, or like medications will not work. The only medications we use in dentistry is either antibiotics to just decrease the acute conditions, or analgesics to like decrease the pain. And none of this will work with any of the conditions we treat in dentistry. It's only temporary treatment for like, to prepare the patient for surgical extraction and surgical procedures. This is like, these are four of my cases that I've been working with. This case is just like one of my patients. This is what I was trying to tell you, that you can see the results immediately on the patient's face. This patient was edentulous, meaning that he doesn't have any teeth in his oral cavity, and I was able to restore all of his teeth for him by a removable dental prosthetics. And this is the final result. This was before, and this is the after, and this is the final result. He was satisfied. He was very happy. He one of the things you feel happy when you see the dental field is that he cried and he hugged me. He was like, I've never seen my smile for like 13 years now. And it was just satisfying for me as a dentist before him as a patient. And the second case is called diastema closure. The diastema closure is like this condition where the teeth are away from each other. People treat this by orthodontics, but actually this patient was one of my family members. She was, as we can say, she didn't want to wait for the orthodontic treatment. The bad thing about orthodontics is that you have to wait a lot of time, minimum a year, and that's not a privilege that everyone has. So this actually was my aunt, my mother's sister, and she had this diastema. I had to close it for her before like a ceremony she had, and it only took 30 minutes and 15 seconds. So that's what I was trying to say, that you can see the immediate results on the patient's face, his happiness. And as you can see, the results were like very good. Actually, I didn't know that it would be this good. But yeah, it was like very one of the best things like I've worked. Like this is one of my best cases. And the third case, as you can see, I was writing on it like extraction of extensively decayed lower wisdom, and the time taken was 8 minutes 32 seconds. So I'm working on the time. As I said, the bad thing about decayed molars is that you cannot find a grip. You can easily fracture the molar while trying to get it out because it's actually so weak, lost a lot of the tooth structure. As you can see, the decay almost took half the crown out, so you cannot have a grip by the force or by the like if you put some force, large force, you can easily break it, fracture it into two, which will cause like fragments that will put you in the risk of leaving some fragments inside the wound and stuff like this. So what I'm trying to say is that you must take the tooth as one unit as possible, because breaking it will lead to like distraction of fragments that if you close the wound on these fragments, it will lead to an infection that you don't want. And that the fourth case is a scaling case. It's actually in the field of not surgery, it's in the field of periodontology, which is treating the gums and cleaning the pockets found in the gums. This is one of my patients. He's like the same age as mine. He is a heavy smoker, and like he smokes 2 or 3 packs a day. He drinks a lot of coffee, and the upper picture where the label before is that you can see these are soft deposits at the upper teeth, and the black spots are the hard deposits, where it's hard to take off, that you can easily injure the gingiva. As you can see, the color of the gingiva is turning to be like gray or violet or dark red. But if you saw the lower picture after the treatment, and by the way, these two pictures are in the same day. Difference between them is 1 hour. So as I was saying, you can see the results immediately in the same day. That will like you can see the satisfaction of the patient. So after the treatment, which actually like this is not the full treatment. Like this is the first session. This like treatments of this cases like needs 2 or 3 sessions to follow up the gingiva and follow up the gums state and stuff like this. So as you can see, after removal of these deposits, the tooth became more white. It became more shiny, and as you can look at the gingiva or the gums, you can see that became the more normal color of these structures, which is pale pink, not red and not violet or a little bit black or a little bit brown or gray. Like you will see a lot of changes in the colors according to the condition. The more darker the color, the more severe the condition is. But this is the normal color of the tooth. You can see that there's some like trauma to, okay, one second. You can see that there's some trauma to the lower gingival margin because of the instrumentation, because the calculus and the deposits were very deep inside the gingiva. So it requires some intervention by these instruments subgingival, where you place the instrument below the gingiva to take out the deposits from its base, so you don't leave any deposits under the gingiva that will lead to an infection or an inflammation later on. As you can see in this case, you immediately saw the difference. You immediately saw the resolveness of the inflammation, like in the gingiva when it gets inflamed. Like a moderate inflammation will look like this, the picture before, and a normal gingiva will look like the picture after. The difference is that there's no swelling. The gingiva became shiny again, became like, it looks more alive. And it's actually like this, none of these photos are edited. None of them are edited. So as you can, like if you focus a little bit on the gingiva and on the lips and on the teeth itself, you will find a big difference like before treatment and after treatment. And as I was saying, I will keep saying this more and more and over again. The dental field and dentistry, you can see the results immediately after the treatment is done. And this is the best thing about dentistry. You can see, like you can understand after you finish the treatment that you have been working good enough on yourself or not. You can like see where you need help, where you can go search for help, go search for information. You will understand the problems you will have and how you're going to deal with it. Everything. Just like this is the best thing about dentistry, is that you can see before and after results in the same visit, maximum in the second visit. And yeah, that's all what I can say about the dental field and the surgical field. Yeah, I'm done with my presentation. I hope I helped any of you guys and that I gave you any information you needed or required. You can ask me anything if you want. You will just have my contacts, like the email, the Instagram page, and everything about like all my contacts and social media. You can contact me anytime. I would be happy to help. And as I said, you can just ask for solutions for some treatment, or like you can ask for treatment planning or any of this. Like I'm here for you guys. Yes.
Alrighty. Thank you so much, Dr. Muhammad. This was a very informative and amazing live session. So thank you so much for agreeing to be our host for today. So we have about 5 minutes for some questions that people ask. So I'm going to go ahead and ask you some of them. They're from the Instagram and from our YouTube Live. This one is from our Instagram, and it says, what was the hardest part of dental school?
The hardest part of dental school is that you can sometimes fail in some procedures and some skills to master, and you will not find like a lot of encouragement from your colleagues and from your professors. So just don't give up. That's the most hard thing in dental university, is that you don't give up.
Awesome. And then this one is from our YouTube. Let's see. So someone is asking, are sores beneath tonsils or back of the tongue normal? Are those taste buds?
No, that's not normal. Of course, that's not normal. But I can see that this is not a dental problem. Most of the time, it's not dental problem. Like, yeah, there's 10% of the cases dental problem, but most of the time, like, I guess he can go check for COVID now.
Okay, and this is from our Instagram. When did you realize dentistry was for you?
Well, I realized dentistry for me was in the first year of high school, where I went to the dentist with my family member for like a regular check, and like I saw the difference, as I said, before the treatment and after the treatment at the same time. That family member, he couldn't sleep from the pain, and like on the same visit he got relieved, and that what made me like I want to help like this.
Awesome. And another question. Okay, so why did you choose oral surgery over any other specialty?
As I said, like it's like the mistakes you can do in this field are very like little, and I'm a little bit aggressive of personality, and that's what I know about myself. And oral surgery just give me this space. And the last thing I want to say about this, like why did I choose the oral surgery? Um, it's because yeah, it doesn't work a lot with aesthetics, so you don't have to deal with the patient's requirements as they want, because sometimes you do the best job that can be done, and then the patient is not satisfied. So you will have to work with grumpy patients. You will have to work with patients that have no tolerance for opening their mouths and stuff like this. But in case of oral surgery, you will just like give the patient anesthesia, and you'll not have to deal with anything of his like problems. So that's the best thing about oral surgery.
Okay, and to follow up on that question, have you ever encountered a situation where it was hard to work with the patient, and how did you handle that?
Well, the hardest, like in dentistry, you don't find these situations very like a lot. The hardest thing with patients, and it's actually with not with some type of patients, it's with all of the patients, which is the anesthesia. But all of them are afraid of the injection. Like the moment they see the needle or the syringe, they just like, I want to go home, and okay, I can live with that pain, but actually like that's it, nothing more. Dealing with the children, I'm not a fan of children. I like them when they are like 9 years old or older, not before that. So yeah, dealing with children is the hardest thing in dentistry. The periodontics is the hardest field of dentistry, but other than this, like these two problems, nothing is hard in dentistry. You can master everything with just you, if you took yourself, if you give yourself the time required. That's it.
Alrighty, and we'll just take one more question, and that is, what was the hardest part of adjusting to America from Egypt?
Actually, a lot of things, but like mainly the cultural difference. Like the cultural difference is the main thing. Like being an Arabic country, we deal with situation in different way than the like the US people deal with it, and it's just like that's not the cultural difference. Meaning the cultural difference I cannot explain actually.
All right. Well, it's already 6 over here, 7 EST. So we will go ahead and conclude today's session. Thank you so much, everyone, for attending. And yeah, I think we're good.
Okay.